When South Africa announced it had found a new COVID-19 variant that should be of public health interest, the world turned its back and shut its borders. Now, countries hurriedly imposed travel ban and restrictions in what has been described by the World Health Organization as a blanket decision. The group of researchers, the country, and the continent that found Omicron in good time have not been credited for their discovery. Rather, Africa is shut from the world in a manner that begs the question, is the world against Africa? Welcome to VSA. I'm Sulaiman. Well, it's been one wave after another since the advent of the COVID-19 pandemic. When the disease and virus broke out, many thought Africa was sitting on a keg of gunpowder, waiting to implode. Now, its weak health structures have always been a nemesis to its development, and when the world faced a disease which had a very high infection rate, the worst was expected for Africa, but that worst didn't happen. How it did it is still a mystery. African governments moved against COVID-19, quickly announcing lockdowns and placing travel restrictions. It was a humble response to an unknown enemy. Researchers are still all out to look for why Africa is not badly hit. For many, it's mere luck. Some claim it's the very young population. In extreme cases, they say it's sunshine. Whatever it is, Omicron was found by South African scientists, but its roots are still unknown. To treat and label it an African virus in the world is something that many have found disgusting. All of these, especially the latest response to the emergence of Omicron, places a question mark on the integrity and honesty of these nations to Africa. Is it jealousy or a long hand of subtle imperialism? Now let's unpack this. Joining me to look at this is Lorhen Akase. He's the head COVID-19 response team, Lagos University Teaching Hospital in Nigeria's Southwest region, and Professor Thumbi Ndungu. He's a virologist in South Africa, and pretty much later, Stephen Hayes, the former president and CEO, Corporate Council on Africa, will be joining me. He's now the president of Cohen and Woods International. Now, quickly, let's start with you, Professor Ndungu. How was Omicron detected? Perhaps you help us here. And how do you describe the border closure and the travel ban, especially to Southern Africa and now to some countries in the West?
Well, thank you very much for having me on the show. Omicron was first detected by actually Botswana scientists. They're the first ones who described the sequences and deposited in a global database of sequences for COVID-19, where scientists regularly update the sequences and deposit their sequences there. But even before the Botswana scientists had sequenced the virus, South African scientists had actually noticed that in the PCR reaction that we used to detect COVID-19, that some of those PCR tests were showing an unusual pattern, and this led them to suspect that there was some unusual mutations in the coronavirus genome. And so it turned out to be the case that it was a new variant, so first identified in South Africa, first described by the scientists in Botswana.
Well, Professor Ndungu, let me stay with you before I welcome Dr. Akase in here, because I recall then we had this conversation on the news when this news first broke. But quickly, what has happened between then and now, knowing full well that this has actually taken some bit of politics and diplomacy in what is happening between, or amongst presidents of the African countries and Europe?
I think the reaction from the global community has been very disappointing, particularly from the West, because we have had this disease now, this pandemic, for almost 2 years. So we know how to respond to coronavirus. We know how to control it. our measures are not perfect, but we know that social distancing, the sanitizing, wearing of masks, that these are very good control measures against the virus. And we also know that vaccination works very well in preventing severe disease. We know that in the beginning of the pandemic, lockdowns happened and travel bans also happened. And this, it was understandable in the beginning because this was a new virus and people needed to prepare for it. We didn't know how many people would be hospitalized, and we know that healthcare systems are not always up to the standard that is required to deal with respiratory infection. So the lockdowns and in the beginning were justified. This time round, I don't think that there is any justification for lockdowns. I don't think that there is any justification for travel bans. I think it is in very bad taste. It is discriminatory. And in fact, you can see that this is discriminatory given the kind of reaction that we have seen where only African countries that have detected this virus have suffered this travel ban. There are many other countries that have now described the presence of the Omicron variant, and yet we haven't seen any travel bans. In fact, there are some countries, African countries, that have not described any case of Omicron, and they too have been banned from Southern Africa. So this is discriminatory. It is unscientific. It is not going to solve this problem. And the sooner these travel bans end, the better for all of us as a global community.
Professor Ndungu, I think you've used the word many have also used here in Nigeria, especially experts like yourself, that it is unscientific. Let me bring in quickly Dr. Akase. Dr. Akase, good to see you, and congratulations to you and your team. This is the epicenter of COVID-19 in Nigeria, and we'll see what your team is doing so far. Tell us what you know about this variant, because as it stands at the moment, looking at the records, it is yet to kill anyone, even in Nigeria, let alone the world. And how dangerous or mild is Omicron?
Thank you very much, Sulaiman, for having me. It's always a pleasure. Why it's still early days, what we know for now is that people that have Omicron are presenting with mild disease. So far, like you rightly said, we've not heard of anybody who has died of Omicron in the country. The reaction to the discovery of Omicron itself has been, like Professor said, rather disproportionate, bearing in mind the fact that the cases of sin so far are mild. However, it's always good to put in perspective, because this is the beginning of a new wave, more or less, because new waves are usually generated by either a change in the nature of the virus or a change in human dynamics. In this case, we're seeing a change in nature of the virus, which potentially, is able to do so much more than what the Delta virus could do. So for now, we're seeing mild disease, but in terms of profiling, modeling, progress, it's always good to put in perspective that it's still early days. So far, the people who are seen infected are mainly young people and people who probably have been vaccinated or not. If we do have, a widespread community spread, widespread community dissemination, the picture may change. But at the moment, what we're seeing is essentially, mild illnesses, which is not to say it should be underestimated, but to be honest, the reaction has been disproportionate, to say the least.
Now, looking at the task, before you and your team, do you think this closure, against the continent will, spiral into having more people who are vaccine hesitant?
That's a very good sentiment. To be honest, so many people don't exactly know what to do. I mean, we've heard so much about how the West has been disproportionate in terms of how they responded to this, and to a large extent, people, by extension, people are running away from the discussion of how we should approach this month back. For example, with the discussion around equitable distribution of vaccines and all that has been had. And to a large extent, anybody has said that, anybody with COVID anywhere in the world puts everybody in the world at risk. So, to be honest, countries that, sort of thought in themselves that they have it together, the Western countries and all of that, sort of feel that, okay, this is Africa's problem, and we need to protect ourselves. And to a large extent, they panicked and sort of done what they feel they would do to buy themselves time. The UK Secretary of Health said as much, that this was, in a bid to buy time, to learn more, and to see, how this goes. So really, as Professor said, it's rather unscientific. And most of the people making these decisions are honest politicians, so you expect them to take political decisions. But, it goes, further to have discussion around, should we have done more, been more proactive as a global community in terms of approaching COVID? And to be honest, world leaders have always underestimated and misappropriated attention, as far as COVID is concerned. And I think that we're saying, this is part of what we're saying. And people are always wanting to take short-term actions in terms of that. But everybody knows travel bans, and shutdowns have not, controlled COVID, compared to the other scientific methods, as we've seen. Yeah.
Let me bring in Professor Ndungu again. Professor Ndungu, I'm trying to look at the politics in all of this. Recall the former president of the United States. As much as he tried to label it a Chinese virus, the entire world, corrected him, over and over again, saying that, no, this is COVID-19 and not the Chinese virus. Why is it that the same voices are not being heard now that it's almost being termed an African virus?
Well, I think it's a very good question. And I don't have the answer to that question, but clearly we do have a problem here. And you said it in the beginning of the segment where, when this virus first emerged, the predictions were that Africa, because of its poor health infrastructure, would be devastated. So everybody kind of expected that Africa would be hit the hardest by this virus. Luckily, for reasons that we don't fully understand, it has to be said, it didn't turn out to be the case. And the narrative now seems to have shifted where Africa, because particularly Southern Africa now, and because of the high burden of HIV infection that we have, everybody's afraid that somehow this is going to lead to the emergence of new variants. Now, this is not to say that this is not true, but it still boggles the mind why countries that have much more COVID cases are not more worried about the COVID cases they already have. If you look at countries like Germany, for example, the very day that the Omicron variant was described in Southern Africa, Germany had about 70,000 cases of COVID, whereas South Africa had about 1,000 cases of COVID on that day. And yet, so who has the bigger problem in that particular case? It is the Germans, and it is the Germans with the Delta variant who should be taking more measures to control this epidemic rather than sort of shifting the blame to other countries. So in my view, I cannot see any rational explanation for why Africa should be singled out in case of these travel bans, in case of the kind of treatment that we have seen meted out to African countries. And don't forget, this is going to have significant economic consequences. As President Ramaphosa was saying, this is not the kind of response that we expect from our partners. And as I said, again, it is not scientific because it is not going to lead to better control of the spread of this variant.
If the world, the rest of the world, refuse to listen to the arguments of experts like yourself and even political leaders, what do you think ultimately this will mean, going forward? Is there any likelihood that scientists will not be pretty much open and objective in the discovery of, viruses or other illnesses that could turn to a pandemic?
I am very concerned that in most countries, what you're going to see is that governments will start putting pressure on scientists not to share the data that they have openly. And South African scientists have to be commended for the speed with which they have moved to share this news of the emergence of these variants with the world. And even the clinical data that is coming out. I mean, South African scientists have been very proactive in terms of sharing the data and getting the message out as quickly as possible. What I fear is might start to happen, particularly in countries that are averse to democracy, is that you're going to see less transparency, and governments are going to start to put a lot more pressure on scientists to not disclose the information, so that there's a filtering of information, as it were. But actually, I'm even more concerned about communities, much more than I'm even concerned about governments or even scientists, because what is likely to happen is that with this kind of news and with this kind of treatment, I think that communities themselves will begin to wonder whether there is something that is being hidden, whether there are certain communities that are being singled out, whether there's going to be an increase in mistrust within the general public itself, leave alone governments and leave alone scientists. Within the general public, you're going to start to see a rising mistrust of the global order, and this does not augur well, I think, for global solidarity in terms of fighting these kind of public health challenges that we face, in terms of fighting against other challenges that are of a global nature.
Well, let me bring in Dr. Akase back. Dr. Akase, listening to Professor Ndungu, he said some key things there. He used the word mistrust, global solidarity, global order. But let me first ask you this question. Now you're in Lagos, and everyone around the West African axis is always looking towards Lagos. What are the threats? Or have you discovered any Omicron in Lagos? And what are the likelihood of Omicron, appearing if there's not been any so far discovered?
Yeah, thank you very much. That's a very good question. So to put this in perspective, in the country, COVID test, COVID samples that are taken for testing are not routinely sequenced. Not all of them are routinely sequenced. So to be honest, it's difficult to say whether we have Omicron in Lagos already or not. Having had people who left the country and went elsewhere and were, found to have Omicron, it's not unsurprising. We've had cases already in the country which we've not detected. But we all know Lagos, like you rightly said, Lagos is the place where lots of people come in and go out. And the threat to Lagos State and, of course, being a window elsewhere is very real. We know the population of Lagos, and we do know that any infection, like I said earlier on, an infection one place means an infection everywhere. And what we're hoping not to see again is a situation where we do have, if eventually when we know more about Omicron, we'll find out that it's able to cause more severe disease and more diverse manifestations, in the larger in the larger population. Now, we're discussing about acute presentations of Omicron, and as a clinician, I must say this, that nobody knows how far we're going to be dealing with COVID at the moment. I mean, it's a slight digression, but we're dealing with long COVID, which means we're having, complications of COVID that outlived, the acute complications. So the threat is very real. If eventually Omicron, does leave behind some damage to the lungs or to the kidneys or to some other organ, which in spite of an acute, a mild acute presentation, this obviously means, huge economic and medical costs going forward to people who may have, long-term complications, of COVID going forward. So I do agree that, while it's early days, it's a huge threat in terms of, and we should see it as such. Because there's always a tendency to say, okay, since the initial presentation is mild, people should just, not bother too much. And in a way, the communications that we're sending to, because we as clinicians or we as medical people are able to interpret it appropriately. Okay, for now it's mild, but we're not taking anything for granted. The man on the street probably does not understand it. He say, oh, okay, Omicron is mild. So, oh, it's no big deal. They're just making noise for nothing. So yes, while we're on one hand talking about, overreaction and talking about how that this leads to mistrust in people, we also, and this is the challenge really, we also have to pass across the message that people get to understand that, you know what, for now, this is what we're saying, but all hands need to be on deck. We need to study more so we don't, have something come up on us that we didn't anticipate in terms of, the size of what we're dealing with and the complications long term. And like you rightly said, the threat is very, very real, and we must look at it as such.
So, Dr. Akase, so far, how is the vaccination drive going? And we hear stories of a booster vaccine, coming.
Well, yes. So Nigeria and like most of Africa, some of African countries have a challenge around availability of vaccines. We don't have enough vaccines for everyone, but a bigger problem of acceptability of vaccines. Now, you mentioned earlier on about mistrust, of among the people for various reasons, some of which we may not be able to get into here. So, in terms of the drive, there's a lot of work to be done, and that is being done in terms of encouraging people to come and get vaccinated. The federal government is trying various modalities. So, so far, it's going on at a steady pace. We are about 3% for people who have completed vaccination, so which is nowhere near what we intend to accomplish as a country. But, now, obviously, with new variants coming out and the immunity waning, getting lower over time, obviously, booster doses are just the way to go. In the country, we have people who have had AstraZeneca. Those who took vaccines in Nigeria are the ones that would have done 6 months and so are qualified, to get vaccinated. But obviously, like we thought from the beginning, that a time will come when probably we'll have to start looking at, are we going to be getting yearly vaccines for COVID? Or until we get, newer modalities and technologies of vaccines that are able to give longer lasting, immunity. At the moment, it would seem that, getting booster doses is the way to go until we reach herd immunity, that is enough to suppress, that. The challenge with low immunity within the population is the fact that new infections will be going on, and the real challenge with Omicron, in addition to the fact that it can cause severe disease in people, which we're not seeing yet, is the fact that even if it's not causing severe disease, as Professor was saying, infection from one person to another going on is a very good recipe for newer mutations coming up. So we're already talking about a variant that has so many mutations. More than Delta, but if we still keep having people infection from one person to another one, there's always a potential that new mutations will come up, and that probably is one of the major dangers. It's sitting time bomb really in terms of what it means to us going forward. Yeah.
Well, Professor Ndungu, help us here. You're a virologist. Let's see if you can actually break it down for us in simple language so that we can understand. How does this mutation occur? Now, Dr. Akase just reminded the world that there was Delta variant and now Omicron, and there might also be another just on the corner waiting to be so discovered. So let us in on what exactly we're dealing with, especially your colleagues who are observing and also working, to understand the development of this virus.
Yeah, so let me try to explain this in simple terms. What actually happens is that every time the virus gets into a cell and starts replicating, in other words, making more copies of itself so that it can spread, it makes mistakes in its genetic material. And unlike human cells, which also can make copies of themselves, human cells are very complex, and they have a mechanism to repair when they make a mistake within the genetic code when they are replicating themselves. Most viruses, particularly RNA viruses, don't have this capability to correct when they make a mistake when they are replicating, and so those mistakes get carried on as mutations, and that's what we call mutations, so that their genetic makeup now begins to look slightly different from the one of the parent. every time the replication happens. And some of those mutations lead to the death of the virus. So the virus, actually, because of those mutations, is not able to replicate anymore. It becomes a dead end for the virus. But in some cases, the mutations can actually make the virus, by chance, to be either more transmissible, or in some cases, the virus is actually able to evade immune responses. And this even increases this chance of making a virus that can evade immune responses also increases if you are putting immune pressure, particularly suboptimal immune pressure on the virus. Because what the virus tries then to do is that it replicates those viruses that are able to evade the immune responses. And so when these viruses that are able to evade immune responses start spreading in the community, it can be a very deadly outcome. So mutations are part of the virus life cycle. They happen all the time when viruses are replicating. And the more replication you have of the virus, the more chance that you're going to get mutations. So the more the virus is passed on from one person to another, as Dr. Akase was saying, the more likelihood that you're going to get mutations. And if you also have what we call suboptimal immune responses, in other words, somebody is not making good immune responses to completely suppress the virus, that will also increase the chances and the likelihood of those resistant viruses being transmitted within the community. So this is why we need to, as much as possible, ask people to, take vaccines, because the immune responses quickly suppress the virus and reduce the level of replication. But we also need to ask people, particularly people who are HIV infected or who have other immune conditions that interfere with immune responses. Those conditions need to be treated so that you don't get this persistent virus infection, which can lead to these mutations.
I'm excited. At least you've been able to clear that so that those who are vaccine hesitant should also know that the vaccine can help slow down the activities and the speed and the mutation just in case it gets to them. I know you're very busy. You'll be leaving us very soon. But before you go, quickly help us here, because your colleagues, when people get so worried, I can imagine what they'll be going through. Look, the world should first, we're not asking the world to celebrate us, but we've been able to, uncover, discover, and alert the world. But this is the kind of treatment and attitude our discovery has caused Africa. So what's the conversation amongst all the virologists, especially in Southern Africa?
I think in general, the conversation has been very positive. I think it's Martin Luther King or somebody who said that the arc of history is, I can't quite remember the quote, but it's wide, but it always bends towards justice. So sometimes, I think as Africans, we are treated badly. I think sometimes there's a bit of discrimination against Africa and against Africans. But I believe that we have to continue doing good. I think eventually we will be vindicated. And I do think that at the end of the day, African scientists have done very well in combating COVID-19 with limited resources. I think we are doing well as a continent. Of course, there is economic hardship as a result of this pandemic. But I think overall, the reaction in Africa has been very good. And so just maybe as a parting shot, I would like to emphasize, as Dr. Akase was saying, that by no means should we take this lightly. Just because we are saying that there has been this discrimination and there has been this unfair reaction from the global community, it does not mean that we should now rest on our laurels and think that we can just wish this virus away, or that it is not a big deal. I think we need to take it with the seriousness that it deserves, take all the precautions that are available to us, wearing of masks, sanitizing, keeping social distance, and of course, administering vaccines where they are available. and continue to do the kind of good public health work that we have done, whether it is genomic surveillance, whether it is other public health interventions to deal with this problem. I think we have to continue to do that in Africa and move towards self-sufficiency. Research and development is very, very important, particularly for our young people, because our young people are our future, and they need to be on the forefront of developing technologies and ways to fight this pandemic, particularly for the future, so that we are able to make vaccines and drugs on our own without having to rely on others.
What a fine way to end this with you, Professor Thumbi Ndungu. Africa must not drop the ball. And of course, we must protect the future. Many thanks for being such a nice company, Professor Ndungu. Coming up next, Stephen Hayes will be joining me live from the United States. And of course, I still have Dr. Akase. Stay with us. Well, if you just joined us, you're welcome. You're watching VSA here on News Center Television. And of course, we're looking at the virus, Omicron variant. This has actually led to 336 cases of COVID-19 in the UK, and not one has led to hospitalization. At least 39 countries in the world have reported a case of the variant, but survival is still 100%. In spite of these statistics and the shutting of borders against African countries, especially southern African countries, the Omicron variant is still, until otherwise, blown out of proportion by the rest of the world. It exposes Africans to the possible potential of being left alone if the pandemic doesn't leave its shores. By the reaction of many countries in the world, Omicron is an African virus. Well, joining me now from the United States is the Chief Executive Officer and President of Cohen Woods International. Thank you for joining us, Stephen Hayes. And of course, I still have Dr. Lorhen Akase, who is the head of COVID-19 response team at the University of Lagos State University Teaching Hospital. Mr. Hayes, good to see you, and thanks for joining us on the show. Thanks for your time. Quickly, how are you, taking or responding to how the world is reacting to Africa's scientists' discovery of the Omicron variant?
Well, given I should say very quickly, given my background too, I was president of the Corporate Council in Africa, so I have about 20 years of direct working experience in Africa. To answer your question, it's disappointing. I think that we need to be far more receptive, let's say, certainly far more supportive on Africa, from vaccination to education as well. It's been disappointing. And you asked for a quick answer, so that's the word, disappointing.
And because a while ago, before you joined us, I was asking Professor Ndungu, I said, I recall that former US President Donald Trump attempted several times to label the virus a Chinese virus. And the world said, no, Mr. President, you're wrong on this. But we're waiting to see the world say the same thing. But now it seems as if almost everyone is silent.
Well, you're wandering into another area beyond health, which is more of my interest in any case. But I think that the United States needs to do a bit more introspection in terms of its role in the world. The world has changed very dramatically over the last 20 years. I'm not sure that we've caught up with that entirely. I think that we need to be better listeners and more empathetic. And the 1900s are gone. And this is a new century, and I think that we need to be more partners rather than preachers. So I hope that the U.S. will be far better listeners in the future.
Well, okay, I'll come back to you, Hayes, so that we can talk more about the continent and what we should also be doing, knowing full well that you're more or less you're qualified to be called an African. Haven't done this for over 20 years. So let me bring in Dr. Akase here. Dr. Akase, quickly, before Professor Ndungu left us, he said something about everyone going back to the COVID-19 protocol. Are you worried that people are dropping the ball, knowing full well that the Yuletide, the Christmas, the New Year, and so many other festivals around the corner? What should Africans, be doing now that we're getting into these seasons?
Yeah, thank you very much, Sulaiman, for that wonderful question. I mean, this is a sentiment that we've dealt with over and over again. And somehow, I think for COVID, because it comes with a lot of psychological pressure, with panic. The moment, things are going down, people feel relieved. And it's, now we can, we can be free. Obviously, it's been very disruptive, what with wearing face masks and, physical distancing and, having to use hand sanitizers all the time, which is not something, which is what should be going on, but, something people are used to. And this is especially, magnified in a setting where people, have to, this comes at extra cost to people who are just trying to get, things going. And this season, there's going to be a lot of traveling, a lot of interactions, possibly parties. And again, I think this is where we as a country, and we're talking about messaging, just before we went up, this is where the messaging has to be strong and appropriate. Because people are getting the feeling that, Omicron is, and it's true, what we're saying, and we all alluded to that before now, we're saying Omicron is so far mild. So, I've been going around interacting with people elsewhere, and, the message is, there's really nothing in this, and, they're just making lots of noise about nothing. Coupled with, the mistrust that people have for authorities in this country and most African countries in terms of the insincerity people perceive comes from government. Messaging has not gone across, correctly. So, in this season, where there's going to be a lot of, we have a new variant in town, where there's going to be a lot of human-to-human, interactions, where there's going to be a possibility of people moving from the urban to the rural areas, exposing lots of people along the way. The messaging has to be very strong. And always it remains that the non-pharmaceutic interventions, which essentially has been, face masks, nose covers, hand hygiene, and also, keeping space in between people, still remains as relevant as ever. Additionally, vaccination, which is now available to a large degree, it's a very good way, especially for people. And we're seeing situations where, like for certain events, people are saying, well, it's only people who have been vaccinated are invited, for this event. I mean, I saw a party somewhere, somebody was organizing a party and said he's only inviting his friends who have been vaccinated. I mean, I don't know how much that can be implemented, but really the messaging has to be that for now more than ever, people need to really pay attention to these things. Yeah.
So I bring in Stephen again. Stephen, you said that the U.S. should have some form of introspection. And I'm trying to also have this, thinking, for Africa and Africans to also have some form of introspection. Listening to you, what readily comes to mind is that we are dealing with a global pandemic as it is. And it also then needs a global answer, an effort to combating. So what else should the world be looking at, so that it doesn't look like this particular move just might, be a cog in the wheel of progress?
You're right. There does need to be global cooperation, and I think that cooperation is still lacking. the vaccinations need to be spread worldwide. We have more than enough to vaccinate the world. That's not happening at a pace that needs to happen, very frankly. I think that also we're going to have to double down on education, because the doctor is absolutely right. There's too much misinformation. There's too much distrust. By the way, I'm fully vaccinated. I have my booster, and also am one of those persons who are reluctant to get around people who aren't vaccinated. I think we need to take that into account and sit down in cooperation. But I don't see the cooperation. You see it at the World Health level, certainly, but the political strife throughout the world, including the United States, and one might even say especially the United States these days, has not helped in this pandemic. I think we need to take care. I think we need to work together, and I think that cooperation is lacking politically. It perhaps is working well at the health level, say the World Health Organization, although that's a question too. But we just are not cooperating politically. We're still acting in old ways. I think the U.S. still, and other countries, look down on others rather than see them as partners. And I think that has to change, and it has to change very fast.
Stephen, listening to you, first again, by the way, I'm like you, fully vaccinated, so that makes two of us.
So we can talk, yeah.
So listening to you, I think what readily comes to mind is the talk of vaccine hesitancy. And some people are a little bit worried, saying here in Africa, seeing what kind of reaction the world is having against the continent, it just might win more people on their side, talking about those who are vaccine hesitant.
Well, I would hope so, but I'm finding within the United States, even with some of my relatives, a split on this. People who are still believing social media, and that's a real problem. I hope that the hesitancy is going to be reduced. I'm of two minds on the news on Omicron being less infective. But because on one hand, people will say, okay, I don't need the vaccine. And on the other hand, I think we need to keep people looking towards vaccination. I think it's the only way that's going to eliminate or end this pandemic. It ended smallpox, it ended polio, so we need those vaccinations.
Before I go to Dr. Akase, quickly, Stephen, now let's see if we can rate the World Health Organization. From your point of view, now going back to sensitization and education, do you think the World Health Body has fared well in sensitizing and educating the world?
Well, I know the leadership. I have a high regard for the leadership. I think they've done as best they can do under the circumstances. Certainly the past U.S. administration didn't help us come together in that regard. Regardless of your political stance, I think it hurt international cooperation on world health. And that's hopefully going to change now. But certainly, I think a lot of people are doing the best they can. Everyone's open for criticism in this, but I'm positive on and supportive of the World Health Organization.
Dr. Akase, you come in here again. Let's talk about Lagos. How is the drive so far? Are you having more people presenting themselves to be vaccinated?
Yes. So within last week, we've had to for something we're doing, sort of follow up. We're doing in some of the places. We're saying that. Yes, we've had facilities where earlier in the year they were struggling. They had to be, reaching out to people because now initially, that the government policy was mainly in public hospitals where vaccinating people. Of course, over time, because of the lack of acceptability, various approaches, the NERA and the primary care board have had to bring out approaches like, taking it to mosques, to churches, and to various other, social bodies that can help, push the drive. And to be honest, it's working. I'm aware of a particular primary healthcare facility that was struggling, to dispense of its vials of vaccine. They had to move those vaccines, to another facility, to get them. We have states where they had to be moving their own vaccines to other states. But in Lagos State, we had, some places where we had to move vaccines to another place so people could get. But we're seeing an uptick in the number of people, who are getting vaccinated, probably down to the fact, and now again down to the fact that the federal government, has said that certain people who are at home need to resume work now. And part of the requirements for them resuming work is that they have to vaccinate, show evidence of vaccination. So it's working. We're seeing lots and lots of people coming up, to vaccinate. And surprisingly, we're seeing, so just to backtrack a little bit, after the first dose, many people had first, we had fall off, not a lot, but a significant amount of people who didn't come for their second doses. So we had a situation where people that took first dose didn't come for second dose. But now we're seeing, among those that have fully vaccinated, a large number of people who are very eager to receive the booster doses when, when it's time. So, we're feeling very optimistic that, the messaging is getting across and, somehow people, are coming out to do that. But like, Mr. Hayes has said, it's very, very important to keep the messaging, appropriate. So that, on one hand, we're saying, Omicron is not too bad. So people and government as well, that's another topic for another day, but he spoke about introspection. And I think, even though we're talking about whether the world is against Africa or not, we do need to also look, at how our governments are sort of addressing this. But generally, the messaging has to keep being in place so people, that response is sustained. Remember, in Lagos State and Nigeria, for example, we're just, less than 3%, 4%, 5%, which is not where we want to be, at all. So that messaging has to continue.
And has there been, some form of rehabilitation and, talking about the weak health infrastructure in the country, specifically places I know Lagos is way ahead of other states. But have you been able to receive more, equipment in terms of the fight against COVID-19 in Lagos State specifically?
Yes, so like you said, Lagos State, we have to commend, both the state government, and the federal government in terms of at least the effort that has gone in way better than, other parts of the country. But if anything, we had an interaction with some members of the presidential steering committee, and the feedback we gave them was, if anything, even the bad situation, if anything, COVID has exposed. We had people that I knew were highly placed in government at the beginning who had exposure to public health facilities for the first time when they had COVID, and some of them appeared very shocked that public hospitals were so neglected. So if anything, this has, sort of put a pressure in putting, at least some, level of strengthening, within health facilities. There's still a way to go, but to be honest, we've seen an increase, which again goes to the waves. When the wave comes up, you see, more effort comes up. But generally, over the past 2 years, we've seen, some level of improvement. We call it some level. It's getting better, but of course, there's still a lot of room, for improvement. But in terms of that being an advantage, definitely can count it that COVID was an opportunity, and we did see some, improvements, in some facilities. You are aware that the federal government did give some intervention funds to almost all the tertiary institutions a while back. Of course, how they went about using it is another thing, but generally, this has, meant some improvement, of some sort, yeah.
Stephen, you've rightly said that this is a global fight, and for such, everyone should be on the same page. Now, research doesn't come cheap, and it's amazing looking at the number of billionaires the continent, talking about Africa, has. We haven't actually seen a lot of them putting their money on research. What should be your message now? Because if everyone and anyone from across countries pool resources together on research, then we'll be way ahead where we are at the moment.
Well, in the ideal world, that's absolutely true. I want to say that this issue is very real. I've lost 4 friends in 4 different countries, one extremely close and one friend in Nigeria of COVID. So it hits home for me, and I think it hits home for millions of people around the world. To follow up on Dr. Akase and speaking, one area where I think the United States and Nigeria could cooperate a lot more actively, and where we would be far more supportive of Nigeria, is the infrastructure health system in Nigeria is extremely poor, especially outside Lagos, and it's not that strong in Lagos. And with the country, the size and the wealth, the potential wealth of Nigeria, that's inexcusable. It's an area where I think direct cooperation in the United States and Nigeria would be very good, but also certainly regional and global cooperation, strengthening the health structures. We can send vaccines after vaccines, which I think we have to do and must do, but it's just going to continue until the infrastructure, the global infrastructure and health system is more accessible to all. And Nigeria could be a leader on that. It would take a lot of cooperation, but that's possible.
Well, Stephen, I think there's a fine place for us to leave it. I must thank you especially for your time, and thank you very much as well, Dr. Akase. Listen to all 3 of you, Professor Ndungu inclusive. I've come to realize Omicron is sending countries to press the panic button. And those buttons shouldn't shut out Africa. It's everybody's business. It's a world pandemic. So the pandemic has been an exposure into where everyone belongs in the world. It's high time the continent built systems that can defeat problems. Once again, thank you very much for being such a nice company, Stephen Hayes and Dr. Lorhen Akase. Well, I'm Sulaiman. I'll see you again. Bye-bye.